Hello, and welcome to the Dance Physio Podcast, a podcast designed to explore ideas and foster discussion around dancer health and wellness. We're here to challenge the status quo, bridge the gap between dance science and the studio, and help change the landscape of the dance industry for the better. I'm your host, Erica Mayall, a dancer turned physiotherapist who is deeply passionate about leaving the dance world better than I found it. I'm so glad you're here. Let's get started. Hello, everyone, and welcome back to another episode of the Dance Physio Podcast. I am your host, Erica Mayall. Today, I'm joined by a special guest who isn't directly from the dance world, but she is an expert on a topic that is very, very relevant to the dance world. So I am super excited to introduce all of you guys to Andrea Mendoza, who is a physiotherapist and a business owner based right here in Vancouver. After noticing the lack of services for teens with scoliosis and their families, Andrea founded the ScoliClinic in 2016. With a growing team and services ranging from one-on-one treatments, group classes, workshops, and a YouTube channel, the ScoliClinic strives to be a center of excellence for scoliosis care, providing high-quality, curve-specific physiotherapy and massage therapy to children, teens, and adults in British Columbia. Over the past decade, she has also learned how to adapt typical business strategy and practice to this highly niche practice. With a drive to learn the anatomy of business, Andrea completed the Executive MBA program at SFU's BD School of Business with training in international markets through the Business in the Americas certificate. Combining this knowledge with her experience in building a specialty practice and an enthusiasm for philosophy, strategy, and leadership, she brings ideas from the conceptual world to material to push healthcare forward in her own business and supports others to do the same. In 2023, she was also honored to receive the Business in Vancouver's 40 Under 40 Award in recognition of her achievements. So I am super excited to welcome her to the podcast today. Thank you so much for joining me, Andrea.
And thank you so much for having me.
All right. So we are going to dive into kind of all things scoliosis today. But before we start to get into like the nitty gritty of it, can you tell us just a little bit more about how you came to specialize in this topic? Because it is like such a niche area within the physiotherapy world.
That's a great question. And it's an interesting one because I myself don't have scoliosis and none of my childhood friends or close family had it when I was growing up either. So this is really something that was fairly new to me when I entered the field as a physiotherapist. So when I started my career, I was at Kids Physio Group working with kids and teens with special needs or developmental conditions or sports injuries as well too. And I met a couple teenagers who were newly diagnosed with scoliosis. And I was a new grad and pretty keen. And I thought, hey, hold on a second. We didn't really learn much about scoliosis in physiotherapy school. And I don't know, Erica, when you went through physio school, I'm assuming it was the same for you too. Yeah, and I've spoken with a few students who are in the program now, and it still is the case where we maybe get 5 or 10 minutes just to introduce the fact that this condition exists out there, and you might come across it. And so when I was meeting these families, I met 2, 3, and then it was like 5. And I started to think, okay, there must be some other way to support these families. And so I Googled to see what sort of training methods were out there. And I came across something called the Schroth method. And I looked to see where this course was being offered. And at the time, it was only in Milwaukee in the US. And so I traveled down to the Midwest, and it was freezing cold in February. I distinctly remember. And I was there for 9 days for my first level. And we talked all things scoliosis from morning until evening. And I came back with this fire, feeling like I cannot believe that more people don't know about this. And so when I started to share this with those few families that I was supporting, they got really excited because they had heard about scoliosis too, and then Schroth, and they had heard that there was this treatment approach that kind of was out there, but wasn't really accessible at the time. And so I also have to credit the time in history that all of this was happening where so this was 2015, 2016, and parents were starting to get onto Facebook groups support groups at the time. And it was, it was becoming a little bit more mainstream. And so parents were going to look for support and chatting with each other. And so a few of these parents were part of these support groups. And then it just kind of spread by word that there was now somebody in Vancouver who was certified in the Schroth method. And so very quickly, my caseload swung from being, maybe 5% teenagers with scoliosis. Then it was like 50, 60, 70%. It really swung that way. And then when I started meeting more of these families, what I realized was not only are these teenagers presenting in a similar physical way, right? They have a scoliosis curve. They're kind of in the same age range, that kind of thing. A lot of the parents were also presenting similarly. They didn't know each other, but from a psychographic perspective, meaning that they were coming with anxiety. They all felt like they weren't being listened to. They felt like they were being kind of tossed around the medical system and that people weren't, answering their questions. And so I started to think, okay, if there's enough of a trend here, maybe I could build something that, of course, I'm not going to solve this whole problem of the healthcare system for scoliosis, but maybe I can at least address some low-hanging fruit and get a few things in place. And let's see what it would be like to create a space that is specifically designed around all of these needs for teenagers with scoliosis and their families. And so I, with at the time, no business training, truly probably a lot of naivety in terms of what I was getting into, thought, hey, I'm going to do this. And then I decided to launch the ScoliClinic.
Amazing. And I think that story probably resonates with a lot of especially healthcare practitioners who listen to the podcast, because a lot of people who go into dance kind of specialty and physio as well are very much the same, where, maybe they do or do not have their own personal background in it, but it's like this passion, and we have, no business training, and are just like, we see a niche and a need and a population that needs services. And so we're just going to go for it. So I'm sure that resonates a lot with a lot of listeners.
It's the same thing. I think at the start, it was just me. And I remember my parents very distinctly saying to me, are there even enough people with scoliosis to support you doing this full time? And I said, great question. I'm going to find out. I don't know. I wasn't sure. I knew that statistically, there were many, many people with scoliosis. So it's 3% of all teenagers. And that number rises with age. Kind of in the middle age years, it's anywhere between 15 and say 20 or 25%. And then in our older population, some studies say that it's up to 50% of older adults have some sort of spinal deformity that makes their spine asymmetrical, which is another form of scoliosis as well. So I knew that statistically that existed, but I wasn't sure if the community valued physiotherapy for it specifically.
Right.
But then quickly enough, I was overwhelmed, and then I had to, hire other physiotherapists. And so now we're at this phase where our team, we have 10 physiotherapists and 2 massage therapists who are all trained in scoliosis approaches. And we have so many new clients, day after day, who say, oh, wow, I'm so glad I found a place that all you focus on is the exact thing that I'm looking for help with.
Yeah, absolutely. All right. I want to back it up just a tiny bit, because we could go down this road for ages, but I think a lot of people within the dance industry know the word scoliosis. Like, if it comes up when I'm seeing dancers in the clinic, people are familiar with the word a lot of the time, but they don't necessarily know exactly what it is, or maybe have sort of some vague idea of like, oh, it's a curve or something, but not really truly understanding like what it is or what's happening. Can you just give us a little like kind of scoliosis 101 on what exactly it is and what's happening kind of like at an anatomical level?
Mm-hmm. So scoliosis, if you ask your average person, if they, like you said, they've heard of it, and if you ask them to describe what it is, they'll say it's a curve of the spine. But let's get a little bit more specific. So scoliosis is actually a 3-dimensional curve of the spine. And so what does that mean? If we look at a person from the back view, this is the most common view that scoliosis will be picked up on. And this is where you'll see, instead of a typical developed spine where the vertebrae are all stacked on top of each other in a linear fashion, a scoliotic curve will often have the spine curved towards the right or to the left of the body. And so depending on, and this presents in many different ways in different people, you could have one curve in your upper back, or you could have two curves and one going in each direction. So you could have a C curve or an S curve, for example. Some people even have three curves, and we have seen people who have four curves because there are some compensatory patterns happening too. Okay. So it can be in multiple directions in the body, but you see a curve potentially from the back view. But if we look from the side view of the person as well too, there are changes that happen in the spine in that plane of the body as well. Sometimes that means that the spine actually becomes flatter than a typical developing spine, or sometimes it means that it becomes rounder, and that just depends on the person's individual presentation. And then also the third dimension of three-dimensional curve is if we look at a person from the overhead view or the bird's eye view. Now we're looking at rotation of the body, and scoliosis, because of the way that the vertebrae develop, which we'll get into in a second, it also affects the rib cage and the shoulder, the rib cage, the lumbar spine, and the pelvis. There's often an element of rotation that comes along with the other two planes of curves that happen too. So it is something that affects the body in all the different views.
Yeah. And I think that's the part that people maybe don't always understand, because people just assume, or maybe, kind of only understand the sort of lateral kind of curvature or like that type of asymmetry. But that rotational part is often really, well, all of the parts, but like the rotational part for sure is definitely a big part of what we see. And especially in dancers, like the way that they're presenting, will often really notice the rotational component because of some of the rotational nature of some of the movements we're doing in dance.
Absolutely.
Do we know why people, because I mean, generally this type of scoliosis, and there are different types, and we maybe don't want to dive into all of that specifically, but what we're kind of referring to right now and have been alluding to is what we would call like idiopathic scoliosis. And so generally when we're talking about something idiopathic, it's meaning it just kind of is happening, and maybe we do or do not understand why it's happening. But do we know a little bit more now about potentially why it is happening? Because I think there's, again, maybe some like misconceptions that it's because somebody's carrying a backpack on one shoulder all the time, or things that were maybe like preventable, or it's postural, or they're slouching, they need to stand up more straight and things like that. But in an idiopathic scoliosis, that's not necessarily the case. Like it's an actual physiological process that's happening. But do we understand like why some people develop it and some people don't?
So to my understanding at this point, it is still idiopathic, meaning that the medical community hasn't exactly put their finger on, yes, this is the one, just trigger that causes it to develop or not. However, I do think I know that there are many research groups around the world who are looking at scoliosis from a variety of different angles. And so how we describe it to our patients now is that it is multifactorial. It is usually some combination that creates a perfect storm in terms of genetic history. And in terms of genetics, that doesn't even mean that, because we do have some families where, for example, grandma will have a history of scoliosis, and so will mom and maybe an aunt, and then the daughter has it too. And sometimes that's a very clear genetic, presentation that we see. But we see many clients who have no known history of scoliosis, and they have a rapidly progressing curve. But there would still be something in their genetics that would have caused or at least contributed to that happening. So they're looking at genetics. They're also looking at the role of hormones, because we know, for example, that females tend to be affected more than males. And this also often develops in their pre-pubertal growth spurt, or the time that all of these hormones and the changes are happening in the body. There is an element of mechanics that plays into it for sure, in terms of after the physiological process starts to happen, the mechanical forces and things like alignment and those other factors that you talked about, posture and backpack wear and kind of activities, can contribute to progression or not, but I wouldn't say that they necessarily cause the scoliosis to begin with. So that's a really important distinction.
Yeah.
I know that there are other research groups that are looking into, proteins and different factors and kind of other aspects of soft tissue development and the disc integrity and things like that, to see how are those contributing to the development of it. But as far as we know at the moment, it is still idiopathic and multifactorial.
Yeah. And that's kind of where I thought things still stood, but it's always cool to hear, like, are there advances in research and, what areas are people starting to look at a little bit more? We know the rates are higher in dancers than in the general population. And that's, I would say, not a new kind of research finding. Like, I've been aware of that maybe for like most of my career, that has been the case. And
Correct.
There's been a few theories about, again, like why that might be happening. And I'm curious if you can just talk to us a little bit, about the difference in rates in terms of like the dance versus the general population. And if we do have any more kind of prominent theories about why maybe we do see higher rates in the dance population.
Good question. And I had a peek at the research leading up to our conversation today. And there was a recent study that was published that said that dancers that scoliosis can be present in dancers in up to 20% of the population. And another study even said 30%. So of course, this depends on the sampling size that the research looked at, and also the level of dancer as well, in terms of kind of entry-level dancers versus professional dancers. But as you mentioned, it is certainly increased in prevalence compared to your typical population of roughly 3 to 8% of people. So in terms of why, I think there are a few different reasons why we see that increased prevalence in the dance population. One is the genetic factors. So there's a typical phenotype or physical presentation that we see in the clinic for people who have scoliosis. And again, this is not across the board. We have people of all body shapes, body sizes, heights, weights, everything, ethnicities who come into the clinic and present with scoliosis. But there is this very typical common phenotype that we see. And these are typically females. They have long limbs. They're lean. They have low BMI, and they typically are taller. And we have seen that kind of in many different cases. And so many of these body types may select to participate in dance.
Yeah.
So there's that kind of like a selection process that's happening there too. And as you know, I'm sure you deal with this on your clinical day-to-day, that many dancers are genetically predispositioned to being more flexible or more hypermobile or have more joint laxity. And these things, the things that tend to make dancers good at dance, right? Because this enables them to actually get to those end ranges and to do those really big movements. Those are also the genetic predispositions that increase a person's risk for developing scoliosis.
Yeah.
So there's that on top of it too. And then additionally, there are other things like diet and nutrition relative to training volume, whether or not that's, conscious, or if it's, for example, there is an increased prevalence, I believe, in disordered eating in the ballet or the dance population. And so that can also lead to a decrease in nutrition, which affects bone and joint and ligament integrity too. And bone quality certainly affects the rates of scoliosis as well too. So there are some studies that show when they looked at bone quality that there is an increased prevalence in those people who have lower bone density as well too. And so those are kind of some other factors. So in terms of genetics and preferences, those are contributing to that. But there are also mechanics. So if we think about treatment of physiotherapy or of scoliosis, which we'll get into, treatment of scoliosis is typically approached from a mechanical perspective. So physiotherapy and bracing both try and address the alignment of the spine and muscle imbalances. So that's how and there has been lots of success in treating scoliosis curves. So if we flip that on its head, if we think there must then also be mechanical factors that contribute to progression of scoliosis to some degree. And I do believe that in dance, because it demands so many movements of the spine, that there are probably some movements in dance that do contribute to a progression of the spine. But it's important, I really want to say here, that not all scoliosis curves progress. So it's important to note that. And I also want to say that it is just because there is a risk that dance movements may contribute to progression of scoliosis, that would not necessarily be a reason to, for example, pull your child out of dance, because the research has also shown that any activity is better than no activity for all the multitude of reasons that we know.
Yeah, absolutely. And I think what we see in the dance world a lot, and I've talked about this on the podcast previously, and I could not tell you on which episode, but there are things within the dance world that we can change and that we can address that kind of decrease some of that risk. And one of those things is we often see dancers really training specifically on one side and not necessarily symmetrically, because they'll have a quote unquote better side. So if they're doing solos and stuff. And so we've talked about that lots on the podcast before, but making sure that we're training our dancers symmetrically and not letting them have a favored side and just only practicing tricks on one leg. And so we do see that a lot in terms of, and even like dancers I see who maybe don't have a scoliosis, at least yet, but I'll like really notice differences in muscle development from side to side. And so I can look at a dancer often and tell what their preferred leg is just based on the like development of their muscles, and especially like their lumbar spine or their glutes or things like that. And so if we know we have a dancer who has a scoliosis, we have to be like even more careful about that in terms of like how we're training. And so like you said, there are probably mechanical things that maybe contribute, but we can hopefully minimize some of that risk or like minimize some of those contributions by making sure that we're hopefully training our dancers equally from side to side and not allowing them to kind of get into that habit.
Yes. And that's also where, say, an expert like yourself in dance physio or physio for dancers, you can look at a lot of those symmetrical things and you're able to pick up on those different patterns and work on that symmetry from a functional dance perspective. And working with a scoliosis trained physiotherapist can be really helpful for these dancers so that we can take a look at to say like, okay, of course you have to do your choreography and it has, for example, a lot of back bends or it has a lot of twisting. Okay, we want to make sure that you can still participate and do your choreography, but maybe are there some conditioning exercises that you do on a daily basis? Is there some modification that we can do there to support your spine and to make sure that we're not feeding it with more of these mechanics that it may be potentially contributing to progression. And so it's modifying what we can, but then also honoring, the aspects of dance that we aren't able to modify, but it really is trying to support them in a symmetrical development from a supportive spine kind of perspective as much as possible.
Yeah, absolutely. I want to circle back a little bit into kind of talking about why the rates were higher in dancers. And I'm curious to get your opinion on whether you think this factors in or not. But there's an idea within the dance world that kind of is circulated. And I guess just like a little aside, I actually do have a mild scoliosis, and it was discovered by one of my dance teachers when I was like probably 12. I don't actually remember exactly how old, but I very distinctly remember her. My mom was a physician, like a family physician. I remember my dance teacher after class one day being like, hey, like, come take a look at this. And I remember them like drawing a dot on like each of my vertebrae and my mom being like, oh yeah, okay. And then, taking me for x-rays and all of that. It's quite mild and didn't really impact my dancing, but it would have never been picked up had it not been for my teacher who was like, why is one of your shoulders always higher than the other? And so I'm wondering if there's any research to support the fact that some of maybe why we see higher rates in a dance population are simply because dancers are in leotards all the time. And it is an art form and an aesthetic that sort of demands, I use that in quotation marks, symmetry. And so if we have a dancer who has asymmetry through their pelvis or their scapula, shoulder blades, or things like that because of a curve, a teacher is often really likely to pick up on that. Whereas a parent, they're like, I wouldn't have noticed because I see them in clothing all the time. Or if you were a soccer player or another athlete, you wouldn't, your coaches wouldn't necessarily see that. So I don't do you know if there's any research that actually supports that? Because it is a pretty prevalent idea within the dance world, but I actually don't know if it's like founded in any sort, or if anybody's looked at that from a research perspective in terms of like, do we just diagnose it more?
That's a good question. I haven't seen any research studies about just in terms of prevalence rates being associated with awareness and availability of viewing it. But it's very possible that research exists. I'm just not aware of it. However, you're totally right. And particularly because we live in a cold country, or a country that is cold many months of the year.
Yeah.
And the style currently is, baggy sweaters. We have a lot of big jackets. And so it is true that the most common times where scoliosis is picked up on is by dance teachers, because also dance teachers have an incredible eye and they are looking for alignment specifically, and often looking at their back. Pilates instructors, sometimes swimming coaches. And so, or when families are actually on a hot vacation somewhere, and their teenager is now, for the first time in 12 months, they see them in a bathing suit. And then we've had multiple families that say, well, yeah, we were sitting on the beach and then she bent over to pick something up out of her bag, and then I saw this rib asymmetry and I just never had seen that before. And so that's actually really common to say, and I think that's why dance teachers play an incredibly important role in the scoliosis world, because so back apparently in the 70s, I think, they used to do school screening. Yeah. Where there would be a nurse who would be in the schools, and on an annual basis, they would kind of look at these teenagers in grades 6, 7, and 8 and ask them to bend forward, take a look at their back. And then if there was some sort of asymmetry, they would send them off to their physicians. Well, that program got cut. And so there is no standardized screening. Some family physicians will do it if a parent takes their child for an annual checkup, but not every family does that. And not every physician will screen for that, especially if they're looking at other primary health conditions, for example. And so that's why for me, it's really important that community members and the people who are closest to these athletes are aware that scoliosis exists, and that it is really important for dance teachers or other healthcare professionals listening to this podcast too. If you notice an asymmetry in a child's spine, it is really important to bring it up to the family and encourage them to get further investigations, because it is such a time-sensitive window of opportunity where we can make change, or we can prevent it from progressing if it is caught and treated on time.
Yeah, absolutely. And for all the teachers listening, because I know that a lot of teachers listen to the podcast, and parents actually, for that matter, what would be key things that they want to look for in terms of asymmetry? If they were okay, I want to go look at my dancers this evening in class, what would they, sort of be looking for?
Great question. So there are some more common and obvious signs that you can pick up on if the person is just standing in front of you. So some are, for example, a shoulder that is higher than the other, consistently higher, or a shoulder blade that seems to stick out more on one side than the other. And a lot of the dancers who we treat, they'll actually say, yeah, my dance teacher was bothering me, and they kept on saying, tuck your shoulder, or lower your shoulder, lower your shoulder. And it was like a repeat message that was showing up again and again. And the dancer themselves was confused to say, I am doing it. I don't understand. So it's important to remember that in a person who has scoliosis, their brain believes their body is symmetrical. And straight. So there is a mismatch in terms of the brain's awareness of where the body is. And that's a lot of what we do in treatment, is we're trying to reprogram that body awareness. So shoulder height, scapular positioning. The other big one is the waist contours. So if you see that one side of the waist is much more rounded, or if it has a crease developing on one side of the waist, while the other side looks more flat, or even looks fuller on the lumbar spine, that can also be a sign that there's something more going on. Often connected with that is a pelvis shift. So the pelvis may be positioned shift to the right or to the left in relation to the trunk. So if you're looking at the person from the back, it might seem like they're kind of leaning one direction and their hips are sticking out to the other direction. And another sign could be that it looks like one leg is longer than the other, or the dancer feels that one leg is longer than the other. So there are a few different things there. The other major one, so if you see any of those signs when they are just standing there, And then also I should add from the front. Sometimes, especially if they have if they're very lean, if you see that one side of the ribs on the front is sticking out a little bit more than the other, or that their clothes are hanging asymmetrically. So if there are any, when they're especially getting, fitted for their costumes, for their performances, if the seamstress is finding that like they have to gather more on one side, or that, something, they're having to make these adjustments, that could be a sign as well too. So then if you see any of these signs, the next step that you could do is ask your dancer to stand in front of you with their feet together and their legs straight, and ask them to slowly reach forward towards the floor. And you want them to round their back as much as possible in this movement. And if you stand behind them and kind of bend down a little bit so that your eyes are at the level of their back when they bend forward, you want to look to see, is there one side of the trunk? So it could either be the rib cage or in the lumbar spine too. If it seems to be higher than the other side when they are bent forward, then that is certainly something that I would encourage you to refer to either a scoliosis trained physio or a physio in general. Most of us are aware about scoliosis and can assess to see if it is something that needs more investigation, or you can refer right to your physician right away and ask to see if x-rays are appropriate for them at this time.
Yeah, awesome. That's super helpful because, I think sometimes teachers, you get so into like looking at the technique of what a dancer is doing. And sometimes teachers will be like, there's something that's not quite right. And they're so honed in on the technique that they don't always pull back and be like, okay, let's actually look at the anatomy. Is that what's throwing off, making, whatever it is, their arabesque or whatever it is, kind of look a little bit off? So like just having a few little things of like, okay, take a look and see, and maybe that explains why something technically is looking not quite right. So if you are a teacher and you have, a dancer where you're like, there's just something I can't put my finger on from a technical perspective, like kind of, zoom out a tiny bit and look a little bit more anatomically, and that might give you some answers or some ideas.
And I do want to say here that no one of these signs means the person has scoliosis, right?
Yes,
so we want to
absolutely.
really avoid jumping to conclusions. But a lot of what this is, it's a clinical puzzle. And so we want to piece that together to see what's happening. So for example, a lot of dancers who, for example, have a lumbar curve, often in a lumbar curve, the pelvis will shift toward the opposite direction. And then what dancers will say functionally is, oh yeah, I've always struggled to quote unquote, get on top of my leg when I'm doing a turn or if I'm doing any sort of single leg balance. And they say and my teacher keeps on saying, I need to tuck my hip in, but I just can't physically do it. So that's one piece of a puzzle. And then if we look at, oh yes, there seems to be a waist asymmetry. Okay, that's another piece of the puzzle. And there's a pelvis asymmetry. Okay, that's another piece. They bend forward. You see that change in the lumbar spine. Okay, now we're putting together pieces that there could be something more going on, but no one sign necessarily indicates that there is a scoliosis as well. So we have to be cognizant that it is, again, a series of signs, and the X-ray being the probably the most objective one, and that gives us the most detail to determine whether or not they actually do have something happening in their spine, or like you said, it could be due to any other mechanical factor like a true leg length discrepancy, for example.
Yeah, absolutely. That's super helpful. All right. I am aware of the time, but I do want to have a chance to talk quickly about sort of treatment. You have alluded to the Schroth method. That's a hard one to say today already, but can you just, give us a little overview of kind of what treatment options are available for a dancer if they do have a scoliosis?
So depending on the recommended treatment depends on a lot of different factors. One is the age of the dancer at diagnosis, and also does it seem to be progressing or not? And so depending on that, we will, the intensity of treatment recommendations will vary. But there are 4 kind of main treatment buckets that we would that we offer and say that they're available to people with scoliosis. One is just monitoring and tracking. And so especially if the curve seems to be small, if we're not sure if it's changing, at least after that initial x-ray or that initial visit with a healthcare professional, it's really important to come back in, say, 3 or 6 months to re-measure those same things to see if indeed it is changing or if it is stable. There are many people with spinal asymmetries that have stable curves and live happy, healthy, no issues with their spine.
Yeah.
So monitoring for sure, whether that's done by a trained physiotherapist or a trained physician who's familiar with scoliosis. Secondly is scoliosis-specific physiotherapy. And so how this differs from typical physiotherapy is that we look at the person's presentation from an alignment perspective. We take multiple different measurements to, again, try and capture that 3-dimensional aspect of scoliosis. So we want to track all those different dimensions and what's happening in the spine. And then if the person has an x-ray, we take that information and then based on all of that, we create exercises and a treatment plan that is specific to that person's curve. There are so many different curve types out there and so many different presentations. And so that's why one size fits all, side stretch over a ball, for example, that is not appropriate for most people with scoliosis. And it's really important to do exercises that are specific to that person. And so that's where the Schroth method comes in. It's a specific approach that respects this 3-dimensional nature and the changes that are happening in the spine and the muscles. And then we're trying to use gravity and different positions. And if you look, for example, on our Instagram or our YouTube channel, you'll see examples of how these look different than typical physiotherapy exercises. But the whole point is that we're trying to put people in a most neutral alignment as possible and then strengthen them in that neutral alignment and trying to reprogram and reteach their brain that, hey, this is actually a more neutral position. Let's try and see if you can find this when you're doing a functional movement like an arabesque, for example. If a curve is progressing and the child still has growing to do, they may be eligible for a brace. And so there are several orthotists that we work with here locally, and they create custom hard shell braces that help to, from a mechanical aspect, try to bring the spine to a more neutral position for all those hours of the day that the kids are not thinking about their alignment. So when they're sleeping and at school, that's really important. And then if the curve is large enough and generally when it crosses the 50-degree threshold, that's when the conversations about surgery start to happen with the spine surgeon at Children's Hospital. And it's not a hard and fast rule of, yes, at this exact degree, you should or should not have surgery, but it certainly is a conversation because sometimes, or what the research has shown is that if it is not corrected by a certain degree and age, especially if it is continuing to progress, the research shows that over the lifetime of that person, the curve will continue to progress by, say, 0.5 degree or 1 degree per year. And so that there are some decisions where a surgery is actually the best management, even though that is sometimes hard to process for the families. But we've seen many, many people who have gone through spinal surgery and are also living happy, healthy, active lives post-op.
Yeah. Absolutely. That was super helpful. Thank you. Just to give people sort of like an overview of, the different options and sort of that like progression through treatment options, depending on how their curve is presenting in through there. This has been such an amazing conversation. Is there anything that we've not touched on that you're like, wait a second, I really want the listeners to know about this?
I think the biggest thing is that if a dance teacher or a parent who's listening or a healthcare professional, if you think that there is an asymmetry happening, I really encourage you to bring it up to the family because you're right, it may be nothing, but it may be something. And so it's always better to bring it to the attention of the family and then have that, encourage them to seek an assessment with someone who's trained in scoliosis, and then to decide whether or not there needs to be monitoring happening. We have had so many families who say, I wish we started this earlier, or they'll say, oh, I did notice that there was a shoulder asymmetry 6 months ago, but I thought it was nothing. And so I do encourage people to investigate it sooner rather than later, because if that scoliosis curve can be treated earlier, there is a greater chance that we can slow the progression or stop the progression, or even in some cases reverse the size of the curve or make it smaller if the child is caught at a stage where they are still growing. Because by the time they become skeletally mature, there's not much more that we can do in terms of addressing the spinal alignment. We can still do a lot for muscle and function and strength and pain, but really for growing kids, there's a great window of opportunity if we catch it in time.
Amazing. If listeners want to learn more or connect with you or get in touch, what are the best ways to reach you?
If you're curious about what we do or how scoliosis-specific physiotherapy is different than typical physio or what we do at the ScoliClinic, I encourage you to look at Instagram, and our Instagram is the ScoliClinic.
Perfect. I'll link that in the show notes as well.
Great. And if you're a dance teacher or a healthcare professional and you're looking for some exercises that you can give for general strengthening and improving function in a scoliosis-friendly way, we have a YouTube channel called TSC Connect. And there are so many different workout routines, and you can look to find different strengthening and mobility exercises that are in there that are appropriate for scoliosis. But I do want to say that that does not replace one-on-one treatment. The YouTube channel is meant to be an adjunct to treatment. And then, of course, if you're interested, if you know someone who needs one-on-one treatment in that scoliosis specific way that's specific to their curve, check us out at ScoliClinic.ca.
Awesome. Thank you so much. And I will put all of those links in the show notes as well. So if anybody is looking for those resources, check those out. This has been so informative and really educational. I know a lot of the listeners will get a lot out of this episode. So thank you so much for joining me today. I really appreciate you taking the time to come on the podcast. And I also really appreciate everybody for tuning in and listening. I hope you all have a great rest of your day.